will say I didn't do a lot of things right through that journey. As I said, I will have to tell you during my breast cancer treatment, I didn't do anything right. I was depressed. I didn't want to tell anyone about it, isolated myself. But on this one, I really took charge of my health and I engaged with my care team. And I strongly encourage everyone out there to do that. You have to take charge of your health. This is aggressive cancer. And if you're not the personality that wants to do that, maybe you want your a caregiver or your partner to be the one that takes charge of your health and know and understand what this disease is, understand what the treatment plan is. And the way I tell the people I work with it is that you can't just sit back and let it happen to you. You have to understand it. You have to understand what the treatment plan is. You have to understand what the possible side effects are so that you can report them to your physicians. And that's what I mean by take charge of your health. And I also realized that my diagnosis did not determine my prognosis. You can see that they told me I had 6 months to live, and I'm here alive now 16 years later. So you can do things to improve the outcome of your disease. I also strongly believe that you should ask for a nurse navigator if they're available in your community. And a nurse navigator is a person that can help you navigate through your journey. They can help describe what the disease that you have, what the types of drugs or the treatment process that you have. They can also help you if you need to get resources or if you want a second opinion, or if you need to have to go, like in Maui, we have to send people off island for surgeries if you have to go to another resource. They're there for education, to help with teaching you nutritional needs. Also financial resources. They're a tremendous asset. If they're available in your community or your hospital, ask to get a nurse navigator. The other thing that I think is extremely important, and I told you I lost 50 pounds, I dropped down to 90 pounds, and that really, I think, had something to do with my long-term problems that I have today that I have to live with for the rest of my life. I think nutrition is extremely important, and the oncologists here that I work with know when I pick up the phone to call them, they go, okay, I forgot to order the dietitian. I require that for every one of the patients that I work with. Make sure that when you go in that you have a consult with, if you do have one, an oncology, a registered oncology dietitian, nutritionist. Here we don't have that, so I make sure there is a nutritionist that is ordered for a consult. Nutrition extremely valuable. You have to keep your protein, carbohydrates, and especially the total calories that you need to make sure that you can heal. You need that to make sure that your body is healthy and that you can fight this cancer with the treatments that you're on. That is critical in fighting this disease. You need to maintain a healthy weight, you need the energy that you need to survive. I do suggest some sort of diets like the Mediterranean diet, but the nutritionist will guide you in what you need. Always control your nausea and vomiting, because once you've got your diet in control, if you continue to have nausea and vomiting, you're going to just lose everything that you've taken in, and you can get dehydration, which can cause you to possibly have heart and kidney problems. And if you have an infection, that will prevent you from healing your infections. Don't isolate yourself. My first cancer, I did not let anyone come in and help me. But when I had this disease, any invitation I had, I took it. I went out to eat. I went to people's homes, even if I wasn't feeling that great, because that can lead to depression. Please go out and do things. And report, as I said, any symptoms or complications that you have as soon as possible. Do not blow them off. The doctors want to know immediately if you have any problems because they want to act on them. And they can tell you if they think they are something that's important or not. And they really want you to report those signs and symptoms. The other thing that I think that is something that I want you to understand is I truly believe that the internet is a double-edged sword. I encourage you not to go out and just browse blindly in the internet. There are really, truly good internet sites for you to use as resources. Blue Fairy, for one, is excellent. And I encourage you to go out to their site and use them as a resource for you as you move through this journey. The other site is NCCN, National Comprehensive Cancer Network. This is a wonderful site, and it includes all the hospitals that do the research that provides protocols for the hospitals across the United States to set the protocols for all cancers and cancer treatments. And they have one for liver. Use that site. These private chats that are out there are probably not the best sites to go to because they can put you into a depression, and also they'll give you some ideas on this might be a good treatment, this might be another good treatment, but honestly, you should follow the recommendations of your physicians and healthcare team on what is the best treatment for your liver cancer. I also think that it's very important that you document your journey and you create a record. And I did this on my own. I have an app that I have listed my medications, my surgery, my diagnosis. I kept it up to date. I also kept all copies of my reports, everything. And I printed it up and took it with me to every single doctor's appointment, testing, whether it was imaging, whatever, because they would ask you to fill out a questionnaire when I came in. And I would just say, see attached document, see attached document, and they accepted it. So I didn't have to sit there and fill out that document every time I went in. And I also kept one printed out and ready to go anytime I had to go to the emergency room so that it was ready and available when I had to go in. It saved a lot of time, and they actually love the format. If you don't have an app, you can just create a simple Excel worksheet or Excel sheet to create one on your own. As for help, I work with patients, and we set up a grocery run train in our neighborhood for some of the people that we have in our neighborhood, and so that we could do grocery store runs for whenever this patient would need some, just grocery stores, and they'd give us a list and we'd do the shopping for them. So when people would say blatantly, oh, okay, just let me know what you need. And when I had breast cancer, I said, oh, I would just wait and never call them. So when I had liver cancer, they'd say, let me know what you need. And I'd say, oh, it would be very helpful. I'll give you a call when I need someone to go to the grocery store. Would you do that for me? And so I would. I'd call them and say, I've got this list of groceries for you to go get for me. Or maybe you could just say, it would be helpful if someone could take me to this appointment. If that's what you need and someone volunteers, let them know that's what you need. Consult with your oncologist or your hepatologist to see if there's an integrative medicine program in your hospital. An integrative medicine program is an adjunct to your traditional therapy. And that type of medicine includes things like meditation, self-hypnosis, acupuncture, treatments that help you relieve your stress. Believe it or not, sometimes constipation, yoga is an excellent way to relieve constipation from pain medication. Those therapies are wonderful ways to reduce stress that is involved with type of cancer that you have. And many of the medical centers today incorporate integrative medicine with your traditional therapies that you have for cancer. And I have involved integrative medicine with some of the patients that I work with today. And this may be helpful for you too. And those are some of the suggestions I would make as you move through your journey today. And I hope some of these suggestions will work for you. I hope this was helpful. And thank you very much.